Physical activity is very important, 30 to 40 minutes, 3 to 4 times a week. One of the important things to recognize is that indicators such as abdominal fat, big belly, is an indicator and a risk factor for detecting and diagnosing diabetes. So physical activity along with the diet is certainly part of the winning formula to achieve either to prevent developing diabetes, or if you are diabetic, to help to manage it without medication in some cases, or with medication. As far as a specific amount of weight to reduce, I suggest to patients, do your best. Live your best life. Enjoy yourself. Include positive things, physical activity, a life of moderation, and keep in contact with your medical team. I've seen where especially young people struggle with the idea that diabetes is really an old people's illness. I'm too young, and try to ignore it. Ignoring it won't make it go away. The best thing to do is get informed, use that information to develop knowledge, and knowledge is power. The last few years, I've seen World Bank studies that suggested that Jamaica spends roughly 80 to 90,000 Jamaican dollars at that time on each diabetic. Not everybody who's earning minimum wage or just trying to survive can afford that kind of care. So there are multiple channels for patients to access care. There's a public system through health centers and our hospitals, multiple clinics where all the specialists are, so you can get good quality treatment there. And there's private care, whether in private hospitals or what people call their personal doctor. I think at the end of the day, all of us need to do our part to open up as many avenues, both here in the office and in the home and in the general society, to allow diabetics to engage in a positive way. In Jamaica, we have a fat culture. We love fluffy. The bigger the better. And it's time to change that, where our fashions are getting more tailored. It's now more fashionable to be in the gym. We need to make things like the gym and recreational spaces more affordable, more accessible to all of us. These are all opportunities in our schools and communities that I hope when you see this video, you get out and do your best.